Chapter 17, Treatment of Angina. The word angina is derived from the Latin word ango, which means to choke. Angina pectoris occurs when there is an imbalance between the heart's demand for oxygen and the oxygen supply. The symptoms are described as severe squeezing or pressure-like chest pain, sometimes radiating to the arm, shoulders, neck, or jaw. The pain is sometimes described as severe heartburn or indigestion. Angina is a symptom of ischemic heart disease. Ischemia is caused by loss of blood supply to a region of the body. As many as 10 million people have angina. People with a history of heart disease, hypertension, and diabetes are at risk. Lifestyle can also be a risk factor for the condition. In fact, angina is also often classified as a chronic disease of lifestyle because many of the risks for developing the condition are related to lifestyle. Risk factors associated with lifestyle include smoking, overeating, a diet high in cholesterol and salt, excessive alcohol consumption, obesity, and a lack of exercise. Stress can also be a risk factor. High dietary cholesterol is a contributing factor for the development of coronary artery disease and myocardial ischemia. Cholesterol, lipid material, and lipophages are deposited within the arteries. The lipid streaks harden into plaques. This process is called arteriosclerosis. Prolonged ischemia can result in tissue necrosis, death, including to myocardial infarction or stroke. Arteriosclerosis, sometimes called hardening of the arteries, is a condition in which the arterial walls thicken and lose elasticity. Arteriosclerosis can occur as part of the normal aging process. Other risk factors are smoking, tobacco, obesity, diabetes, and hypertension. A thrombus is a stationary blood clot, and an embolus is a moving blood clot. There are 3 types of angina: stable, unstable, and variant. In all types, there's an imbalance between blood supply to the heart and the need for blood and oxygen. The symptoms of angina occur when the blood supply to the heart is insufficient to meet the heart's need for oxygen. Symptoms of stable angina are predictable and are typically brought on by physical exertion, smoking, eating heavy meals, exposure to extreme changes in temperature, hot or cold, and emotional stress. Physical exertion is the most common reason for the onset of angina. Rest and anti-anginal medications such as nitroglycerin adequately treat the acute symptoms of stable angina. Symptoms often subside within 5 minutes. Unstable angina is a serious condition requiring evaluation because it may precede a myocardial infarction. Symptoms are not relieved by rest or anti-anginal medicine and may last for up to 30 minutes. Variant angina is also known as vasospastic angina because it is caused by a vasospasm of the coronary arteries. Unlike unstable angina, it is relieved by medications. Symptoms often persist longer than stable angina and may exceed 5 minutes. Microvascular angina or cardiac syndrome X is a form of stable angina that may produce greater chest pain and last longer. It differs from other forms of angina because some patients have no CAD risk factors. Changes in modifiable lifestyle practices are an important part of the treatment and prevention of angina and other cardiovascular diseases. Other lifestyle changes that should be implemented if possible include taking frequent rest breaks if necessary to avoid angina that is caused by exertion, avoid foods high in salt and cholesterol, eating smaller portions rather than a heavy meal, learning techniques to manage stress, being an advocate for workplace and community-wide challenges that facilitate lifestyle change. Drugs used in the treatment of angina are administered to increase the blood and oxygen supply to the heart and or decrease the heart's demand for oxygen. Nitrates, some beta blockers, and the late sodium current blocker Renalazine are specifically U.S. Food and Drug Administration approved for anti-anginal, approved as an anti-anginal. Some calcium channel blockers are also indicated for the treatment of angina. Current drug therapy for angina has shifted to focus on decreasing cardiovascular events by treating and preventing the cardiovascular diseases that often accompany angina. The following drug classes are used to treat angina: nitrates, beta blockers, calcium channel blockers, and late sodium current blockers. Organic nitrates are the oldest class of drugs used to treat acute symptoms of angina. Nitrates reduce oxygen demand and increase oxygen supply. They dilate blood vessels and increase supply of oxygen to the heart. Nitrates that are commonly used for treatment and prevention of angina are nitroglycerin, isosorbide dinitrate, and isosorbide mononitrate. Nitrates are also indicated for the treatment of congestive heart failure, pulmonary hypertension, and hypertensive emergencies. Nitrates dilate the veins that carry blood away from the heart and dilate the coronary arteries, which supply blood to the heart. When nitrates dilate veins, they reduce heart muscle tension and decrease oxygen demand. Most nitrates are prodrugs that are converted in the body to nitric oxide. Nitric oxide acts at the cellular level to reduce intracellular calcium, block muscle contraction, and relax blood vessels. Nitroglycerin dosage forms include parenteral, sublingual tablets, lingual spray, capsules, sublingual powder, ointments, and transdermal patches. Some delivery systems are designed to deliver nitroglycerin quickly and are used to treat acute symptoms. This includes the parenteral solution, the sublingual tablets, and the lingual spray. The other dosage forms of nitroglycerin deliver medication over an extended period and are intended to prevent symptoms of angina. Vital is a fixed dose combination of isosorbide dinitrate and hydralazine, a predominantly arterial vasodilator. Nitroglycerin is volatile and loses its potency on exposure to light and moisture, so you'll see these in amber bottles. Potency can also be lost if it is repackaged in plastic prescription vials. Sublingual nitroglycerin is packaged by manufacturers in amber glass bottles and should be dispensed in those original manufacturer's containers. A warning label should or may be placed on prescriptions for sildenafil, vardenafil, and tadalafil. Treatment for which are used for treatment of erectile dysfunction, and warning that use with nitroglycerin can cause a fatal drop in blood pressure. All nitrates have nitro and nitra in their brand or generic name. So we have nitrates used in the treatment of angina listed here. Renexa is used to treat adult patients with chronic angina. It is classified as a late sodium channel current blocker. It is the only drug in its class. Renalazine improves coronary blood flow. It works by reducing the sodium calcium exchange, which ultimately decreases calcium ions. The overall effect of this is to relax heart muscles by decreasing contractility. It should not be taken with grapefruit juice because this will cause an increase of the drug in the blood. Renalazine may be used at the same time with beta blockers, calcium channel blockers, nitrates, angiotensin converting enzyme inhibitors, and angiotensin receptor blockers. Beta adrenergic blockers are administered to reduce the heart's demand for oxygen. This is achieved by decreasing the heart rate and thereby reducing the workload of the heart. There are many beta adrenergic blockers, however, only 4 are currently approved for the management of angina. They are atenolol, metoprolol, nadolol, and propranolol. Beta blockers are also indicated for the management of hypertension and post-myocardial infarctions and used for the treatment of migraines prevention. Beta adrenergic blockers all have that common ending of LOL. Beta adrenergic blockers can also produce bronchospasms, so their use is cautioned in persons with asthma. They should be used cautiously in persons with asthma and diabetes because they can produce bronchospasms, and their action to decrease heart rate mask one of the principal symptoms of hypoglycemia. Calcium channel blockers are used in the treatment of variant and stable angina. They are effective in the treatment of variant angina because of their ability to reduce vasospasms that restrict the flow of blood and oxygen. Calcium channel blockers improve exercise tolerance by decreasing the workload of the heart. Calcium channel blockers are effective in the treatment of stable angina alone and in combination with nitrates or beta blockers. Calcium channel blockers classified as dihydropyridines are easily identified because their generic name ends in dapine. Grapefruit juice decreases the metabolism of calcium channel blockers, so apply the warning label, avoid grapefruit juice. And here we have our calcium channel blockers. So we have amlodipine, diltiazem, which you can see has a lot of different brands and dosage forms, nicardipine, nifedipine, verapamil. Then we have a combination Catawit, which has amlodipine, a calcium channel blocker, and atorvastatin, a cholesterol medication. So now we have the summary of drugs used in the treatment of angina. For the nitrates, isosorbide dinitrate should be taken on an empty stomach. Alcohol should be avoided with these. Again, with the nitroglycerin, we want to keep it in a manufacturer's original container. Rotate site of action for the transdermal patch. If no relief of symptoms after 3 doses of sublingual tabs or lingual spray, call 911. We have calcium channel blockers. May cause dizziness. Use caution when driving or performing tasks requiring alertness. And then we have our calcium channel blocker combinations. So avoid grapefruit juice because of the atorvastatin may cause dizziness. And ACE inhibitors, anticoagulants, antiplatelets, glycoprotein 2B, 3A drugs, and antihyperlipidemics may be administered to patients who have angina, especially when comorbid conditions, simultaneous chronic diseases, angina plus hypertension and dyslipidemia. Drugs used to treat hypertension and dyslipidemia are discussed in chapters 18 and 19.